All right, today we're diving into a really clever medication that has one very specific job. We're talking about Clopidogrel, which you can think of as the no-stick signal for your bloodstream. Let's get into how it all works.
So here's the fundamental issue. Your blood is full of these tiny little things called platelets, and their whole job, their natural instinct, is to clump together and form a clot. Now that's awesome if you get a paper cut, but it's a huge problem if it happens inside your arteries.
And that's where Clopidogrel steps in. It sends a really simple, direct message to those platelets. Nope, don't do it. Just keep your distance. That one little command is the key to everything this medicine does. So, let's talk about the sticking point. Why is this clumping thing sometimes such a bad thing? Well, imagine a clot forming inside a critical artery. It's basically a sudden, massive traffic jam on a superhighway. That blockage is exactly what can cause a heart attack or a stroke. We need a way to keep that traffic flowing.
And that brings us to the no-stick signal. Think of Clopidogrel as the traffic cop on that highway. It's standing there waving the platelets on, telling them, keep it moving, nothing to see here, just keep your distance. By preventing that pileup, it keeps those crucial highways open and the blood flowing just like it should.
The official name for this type of drug is an antiplatelet, and I want you to pay really close attention to the wording here. It makes platelets less sticky. Notice it doesn't say it thins the blood. That little difference, it's absolutely crucial.
Okay, so let's be super clear on this, because it's a common mix-up. An antiplatelet is not what people usually call a blood thinner. A true blood thinner, or an anticoagulant, works by slowing down the whole chemical chain reaction of clotting. Clopidogrel, on the other hand, just deals with the platelets themselves. It makes them more slippery, so they can't start that initial pileup. Two different jobs entirely.
So how in the world does it actually send this no-stick message? I mean, how do you tell a tiny platelet to chill out? Well, it turns out it's a pretty clever bit of biological trickery.
It's a really cool three-step process. First, you just take the pill. Simple enough. Second, it travels to your liver, which acts like a power-up station. It flips a switch and activates the drug. Then third, this now activated medicine zips through your bloodstream, finds the platelets, and blocks a specific spot on their surface called P2Y12. You can think of P2Y12 as the big red "Let's Clot" button. Clopidogrel just puts a piece of tape right over it. Button blocked, signal blocked.
Okay, so now we know what it is and how it pulls off its trick. But when do doctors actually decide to use it? What are the situations that call for this no-stick signal?
You'll most often see it prescribed when the risk of a dangerous clot is high. So, for example, after a heart attack or after a tiny metal tube called a stent is put into an artery to hold it open. It's also used after certain kinds of strokes or mini-strokes, and for a condition called peripheral artery disease, where the blood flow to your legs and arms is restricted.
Now, with any medication this effective, there's always a balancing act. You get a huge benefit, but it also comes with a trade-off. It's something you really need to understand.
And the trade-off is pretty straightforward. On one side of the scale, you have the massive benefit, preventing life-threatening clots. On the other side, you have the risk. If your platelets are less sticky for forming bad clots, they're also less sticky for stopping everyday bleeding. That means you might bruise more easily, or a small cut might take a little longer to stop.
Now, while a little extra bruising might be expected, there are some more serious bleeding signs you should always get checked out right away. We're talking about things like really bad bruises that seem to come from nowhere, nosebleeds that just won't quit, stools that look black and tarry, or, and this is a big one, vomiting or coughing up anything that looks like blood or coffee grounds. Those are your signals to get medical help immediately.
All right, beyond the bleeding risk, there are a couple of other crucial safety things we have to talk about. These have to do with how your own body, and even other common medicines, can interact with Clopidogrel.
So remember how we said the liver has to switch on the medicine? Well, the thing that does the switching is an enzyme called CYP2C19. And what's wild is that just based on genetics, some people's bodies don't make a very effective version of this enzyme. For them, Clopidogrel doesn't get switched on properly, so it doesn't work as well. This is such a big deal that it actually has a special boxed warning from regulators.
And speaking of that activation switch, some very common heartburn medications can actually mess with it. Specifically, omeprazole and esomeprazole. They can block that same CYP2C19 enzyme, which basically weakens Clopidogrel's protective powers. That's a really critical interaction to know about.
So this all brings us to the part you play in your own safety, which is huge. First, you've got to take it exactly as prescribed. Second, and listen closely, never just stop taking it on your own. You have to talk to your care team first, because stopping suddenly can actually shoot your risk of a clot way up. And finally, you have to tell every doctor, dentist, or clinician you see that you take it before they do any kind of procedure on you. No exceptions.
Okay, let's wrap up by tackling a couple of really common questions. First one, if a clot is already formed, will this medicine make it go away? The answer is a big, clear no. Clopidogrel is all about prevention. It's a preventer, not a clot buster. Its whole job is to stop new clots from forming. Getting rid of an existing clot, that takes entirely different, heavy-duty medicines you'd get in a hospital.
And the second big question, lots of people know about taking aspirin for heart health. Is Clopidogrel basically the same thing?
Also, no, they're both antiplatelets, that's true, but they work in completely different ways. Think of it like they both want to get to the same destination, but they take totally different highways to get there. And because they work differently, sometimes your doctor will actually have you take both of them together for a kind of 1-2 punch against clots.
So at the end of the day, when you think about Clopidogrel, just think of this. It's not a blood thinner. It's not a clot buster. It's just a small, elegant signal that helps keep the flow moving. A tiny instruction that can make a massive difference.
And just a quick reminder, this explainer is for educational purposes only. It is definitely not a substitute for professional medical advice. You should always talk to your own healthcare provider if you have any questions about your health or your medications.